Nothing is more important than keeping your baby safe. Babies can spend as many as 16 hours a day sleeping. As a parent or caregiver, it is important to be sure that your baby's sleep environment is a safe one. The safest place for babies to sleep is alone, on their backs, in a standard crib or bassinet on a firm mattress. Infant deaths can be prevented by reducing the risk of sudden infant death syndrome, otherwise known as SIDS, and providing safe sleep environments, two factors related to sudden unexpected infant death.
SIDS describes the sudden death of an otherwise healthy infant under 1 year of age. It means the baby dies in his sleep and the doctors cannot find another cause of death. While there are several known risk factors, the causes of SIDS remain a mystery. SIDS occurs quickly and there are no warning signs or symptoms. SIDS happens to families of every background. 90% of SIDS deaths occur in the first 6 months of life, with a peak or highest risk of death at 2 to 4 months.
To keep children safe while sleeping, the American Academy of Pediatrics, or AAP, recommends that you place your baby to sleep on his back every time you place him to sleep, both at night and at nap time. Side sleep is not an alternative to back sleeping and is not advised. Use a firm mattress in a safety-approved crib, bassinet, cradle, or pack and play. Remove all loose bedding and blankets from the sleep area and use a fitted bottom sheet. Dress the infant in a sleep sack or footed sleeper for the infant's comfort. Make sure others who care for your baby know about safe sleep. To reduce the risk of SIDS, the American Academy of Pediatrics also recommends that a pacifier be used when placing a baby down to sleep, but not reinserted once the infant falls asleep. Breastfeeding mothers should wait approximately 1 month or until breastfeeding is successfully established before introducing a pacifier. It's also very important for babies to have tummy time while they are awake and being watched to help strengthen their upper body muscles, which helps development. The best decision you can make for your baby is to not smoke while you're pregnant or after your baby is born. Smoking during pregnancy or exposing infants to secondhand smoke puts them at a greater risk for SIDS. So what is a safe sleep environment? Babies should be placed alone on their backs every time they sleep or nap on a firm crib mattress with a tight-fitting sheet. The crib mattress should fit tightly so that not more than 2 fingers can fit between the crib and mattress. Remove all objects and loose bedding from the sleep area, such as bumper pads, pillows, toys, stuffed animals, quilts, comforters, and blankets. Make sure the spaces between the crib slats are no wider than a soda can. Don't let your baby get too hot. Do not place the crib near a heat source, such as furnace, vent, radiator, or space heater. Dress your baby in a sleeper or a sleep sack instead of using a blanket. Make sure your baby's sleep space is a safe distance away from windows, shades, blinds, and cords. Avoid commercial devices marketed to reduce the risk of SIDS or facilitate bed sharing, such as positioners and wedges.
Remember, safe sleep for your baby should be as simple as A, B, C. Infants should sleep alone, on their backs, in a crib.
Infants can be injured or even die sleeping on surfaces not meant for infant sleep, such as adult beds, soft mattresses, sofas, chairs, water beds, pillows, bean bags, cushions, comforters, or recliners. Pillows placed in the sleep area could cause the infant to suffocate, or he could get trapped between the bed, wall, bed frame, or cushions and stop breathing. These injuries can be prevented by providing a safe sleep environment for the baby. An infant bed sharing with another person or pet is dangerous. Adults, children, or pets that sleep or nap with an infant put the infant at risk for accidental injury or even death. During the first year of life, infants may be suffocated, smothered, rolled over on, tangled in bedding, wedged, or trapped under the person or pet with whom they're sleeping. To decrease the risk of SIDS, the American Academy of Pediatrics recommends that infants sleep near parents and caregivers, but not in the same bed. Parents may also place the crib, pack and play, cradle, or bassinet next to their bed or in the same room. These options are safer for the baby. Remember, safe sleep for your baby should be as simple as ABC. Babies should sleep alone, on their backs, in a crib.